some new options this year with the plan options, something that we have been looking into for a while, making sure we had it right. That's why we're a little bit later in the year in doing open enrollment. Again, just wanted to make sure we got the best options for you guys. One of the options we feel confident is going to give you substantial savings on your medical plans. So we're super excited about that. So I'm going to introduce Ryan. He's with Renewal. He's our consultant. So I'm going to hand it over to him. And after he talks, we'll talk about UKG.
All right. Awesome. Thank you, guys. Like Paige said, my name is Ryan. I'm with Renewal. So we're your all's benefits consultant. If you need help, I'll be around after this if you need personal help. If you want to, if your spouse is really the benefits picker in the family and she or he wants to make an appointment, our page is in the book. I'll point it out here in a second. You can schedule a virtual meeting or they can just call, but they just probably need to use your name so we'll know who they are. But that's completely fine. And I do think that Emily's recording this and they can also watch that. So that being said, we're going to go through the benefits guide, but just a quick public service announcement. This is open enrollment. So if you want to make changes, it's really the best time to do it. So adding, dropping dependents, changing plans, etc. You can change things during the year, but you've got to have a qualifying life event to do that. So it's rare that happens, but you can, if you have a loss in coverage or a marriage, divorce, have a baby, etc. So all that to say, we'll go ahead and get started with the guide. You should have one that says salary benefit guide. So we'll walk through that. And if you want to look at page 4, that is your kind of your vendor lineup, for lack of a better term, your insurance carriers. The changes are Guardian is now your life insurance and disability carrier. So we try to consolidate so you have less insurance companies to keep up with. From last year, Blue Cross is still dental and vision. You still have TextCare across every medical plan, so either option 1 or 2. And then Allied is your insurance provider, but Cigna, remember Cigna PPO is your actual network. And then Smith RX is your pharmacy benefit manager along with Health Equity if you have the HSA plan, which we'll talk through that in a second. So if you want to flip to page 8 and 9, so enrollment in UKG is due by the 11th, but if you enroll by this Friday, you'll be entered to win a gift card. So that's pretty cool. The enrollment experiences we were talking about earlier is a lot more improved in UKGs. I think that over the last year or two, you probably have noticed that unless you're new. But also, Emily made a really impressive chat bot to answer questions inside UKG about your benefits. I for one, was very impressed with it. So you guys should definitely check that out because if nothing else, it's pretty cool to go in there and quiz it. But UKG again for enrollment, and then the other page 9 on this portion of the guide, that's my company, Renewal. So we are a boutique. We're headquartered in downtown Chattanooga. We're here to help you guys again, not just with open enrollment, but if you have like a really big claim issue in the middle of the year, don't be afraid to reach out to us. We'd rather help than not, and we also are capable of helping you on the front end. So if you're going into something, you want to make sure you get it right, surgery, maternity, etc., to where your bills don't come out wrong. Happy to help coach you guys through that stuff. If you got a specific scenario you want to ask me about privately, I'll be around afterwards. Feel free to come up for that. All right. So without further ado, we will get into your medical plans. So that's page 10. Most of your ancillary options are relatively the same. So I want to spend the majority of the time talking about your medical options. So let's start with option 1 because it's going to be pretty similar or identical to what you've had in the past. So this is an HSA eligible plan. There are a few upfront covered services, like you can use TextCare if you're on this plan. You also have a preventive RX card and then your preventive wellness visit. So those are things that you don't have to pay your deductible in order to utilize with option 1. However, everything else you would pay the cost of the visit minus insurance discount up to that $5,000 deductible. So let's say I went to Center for Sports Medicine because I was having knee issues and want to get that checked out, and the visit was $450. I would pay that. It would come off of my $5,000 deductible. Now I would keep paying those same types of charges for anything RX related up to, and including doctor visits, hospital, etc., till I hit that $5,000 mark, right? On the other side, for big claims, again, if you have a $25,000 knee surgery, you pay $5,000, then you're capped as long as you stay in network for the rest of the year. So just as a refresher, that's how your deductible works, and your out-of-pocket matches. So it's really nice. You don't really have to keep up with, well, what's my co-insurance? Your co-insurance is 100%. So once you hit 5, that's it. You're done. 5 for the year. For family, 2 or more people have to combine to hit that $10,000 deductible, and then that satisfies the family portion, right? So on option 1, it does qualify you to both open and contribute to a health savings account, which is basically a savings account that you use for health, dental, and vision expenses. It's your account. It's not a use it or lose it. So you can let it roll over. If you put a bunch of money in it this year, don't feel like you've got to use it all by the end of this year. That's okay. You can let it roll. You can invest it once you get to a certain dollar amount. But on option 1, you can put money in an HSA as long as you have this qualified plan. If you're going to move from option 1 to 2, that's okay. You can still keep your HSA. You just spend it on, whatever you copays, etc. Can't spend it on medical premiums, but health, dental, and vision expenses. But you just can't contribute to it if you switch off of option 1. Okay. So if you enroll in option 1 in UKG, it'll open up the option for you to have the HSA. You say how much you want to put in on a payroll basis, and then you'll be off to the races on that. So that's option 1. Pretty standard HSA plan, just like what you've had before. Option 2 is going to be very different from what you guys have had before, and I would say in a good way, a much different healthcare utilization experience. So on option 2, you're going to have copays for a couple of covered services. But if you elect option 2, Gold Bond is paying for anybody that elects that option to have a membership to Hitchcock Family Medicine. So they'll be here tomorrow, by the way, at 10 o'clock. So we'll talk about that more in a second. But I've forgotten to mention that in the last couple of meetings. But Hitchcock Family Medicine, they've got a couple general medical practitioners and 2 family practitioners on staff, and I think they're adding another one. But they're what's called a direct primary care clinic. So what that means is Gold Bond pays for you to have a membership, so there's no cost for you to access your healthcare through them. Gold Bond's also going to pay for any time you have to have labs and basic like blood panel stuff done there. So if I think that I might have diabetes or a thyroid issue or some type of autoimmune dysfunction, like I could go there. The visit wouldn't cost me anything. My lab work wouldn't cost me anything either, which is a really great benefit to have. They can do a lot of lab panels in-house. If they have to send you out, they're probably going to send you like a lab or something, but it would have to be, I think, a pretty complicated set for them to not be able to administer it. The direct primary care really started because a lot of these guys or ladies who work for, let's say, Erlanger or Memorial, your typical primary care physician will have 3,000 to 4,000 patients. So I have 4 kids. So our kids go to Highland Pediatrics. I have nothing against them, but when we go there, it's like an assembly line. We weigh the kids. The nurse sees us. The tech sees us. Everybody sees us with the doctor. The doctor gets in there. It's a 10-minute visit, gobbledygook, whatever. I'm like, I don't really know what happened, but I guess we're getting healthcare, and then we go pay our bill. That's like, and I think that's probably most people's typical healthcare experience, especially with kids. And you may have a PCP that you've been established with for a long time. If that's you, we're not asking you to switch. But for the majority of people that feel like, hey, it's really hard to make appointments, I don't really access my healthcare because I don't want to have to pay for it. Should be the opposite of that. Like, we want you to use it because it's already prepaid, right? Gold Bond's paying for you to have the membership. You could go 20 times in a year to Hitchcock and call them 15, or you could go twice and call them once. It'd be no difference in the cost to you. So the whole point of it, though, is for you to be able to have a doctor, have a relationship with them so that they can help you actually have preventive, healthcare in your life and not get sicker. They are not incentivized to bill you for more and more when you walk through their door, because they're already getting paid. So that's just kind of setting the stage for, like, what's the model like. Their clinic is really nice inside. It's brand new. They just built it. They had 2 locations. They consolidated everybody into one, and it's right down the road. So that's a really nice, just logistical thing for you guys as employees at Gold Bond, because it's really close in proximity. I would tell you too, with Hitchcock, they can dispense a long list of like generic and some brand name medications for a cash price inside their clinic. So, and pick up too that you can do there. And then again, if you're sick, like, out of town, you can still use text care, but they also will have kind of a text line that they will give you, or a way to get in touch with them, right, on a personal basis, so that they can help you while you're out of town if you get sick. But really, again, the point of this is to give you guys better access to healthcare for as little expense as possible. For imaging, Hitchcock does have an X-ray and a CT machine there. So you'll pay 50% of those costs. Gold Bond will pay the other 50. The costs are already going to be almost like a cash price when you go through them to do those. And if they'll be here tomorrow, they could run you through. I'm sure they'll bring some flyers, but they'll cost out everything for you for your healthcare ahead of time. So there's not going to be any mystery of what you would pay if you choose to go to option 2 and kind of adopt them as, hey, I want to make this my kind of center of my healthcare universe, right? If you need to get an MRI or a scan that they can't do, or you just want a local radiologist to look at it, Prime Imaging, we've worked out a special contract with them where you guys are going to have copays for MRIs, CAT scans, X-rays through Prime Imaging that are really low copays. So like X-ray will be $25, MRI $350, CAT scan $250. So that is kind of we've been working that out directly with them aside from the actual insurance. So we're going to get you guys the updated price list for that once we go through all the details. But they're a client of ours, and they actually do sort of a similar arrangement to you guys. So I asked them, hey, would you allow some of our other clients to just kind of come to you directly and pay a discounted price for services? And they agree. So I'm super excited about that. I think it will help to cut down again on care costs for you guys that you otherwise would have had to have paid. If you go through Cigna, let's say, and you schedule an MRI at Center for Sports Medicine, like it might be $1,000 even after discounts, right? They're expensive. So the price list that Prime Imaging gave us is going to be a lot more economical for you guys. Now you can go somewhere else if you want, but you just wouldn't get that deal. You'd have to pay towards your deductible. So whatever the discounted price would be with Cigna. So I would say if it would be wise to obviously take advantage of it. Prime's a local company. They've got 4 locations: Gun Barrel, Dixon on 153, McCallie, and then I think one in North Georgia. So, but again, Hitchcock can do some basic X-rays, and they'll even do stuff like if you've got Employee Plus Children and your kids are on the plan, by the way, I forgot to say this, they will also have a membership to Hitchcock, as if you're a family, your spouse and your kids will have it. So if you're just employee only and you end up doing it in 6 months in, you're like, hey, this is great. You could if your family has insurance elsewhere, you could buy a membership. They'll give you the prices for it. And I think it's like $75 for an adult, and then per month, and then 40 for kids. Is that right? 50?
50 between 2 and 17, and it's 75 2 and under.
Okay, yeah. So the real little ones are more expensive. So they'll give you those prices. But again, if you are on family through Gold Bond, your family will be enrolled and have memberships with Hitchcock. So they can do stuff like minor stitches and kind of act as kind of an emergency room prevention, if you want to think about it like that, so you don't have to incur those costs. Now, obviously, if it's your kid and you've got to go to Children's, like I get it, sometimes that happens if it's an unavoidable emergency. But going back to the whole purpose of Hitchcock, it really is to be able to give you guys better access to healthcare that's not in a rush, that aren't trying to like fee you for something every time you walk through the door, where you can actually have a conversation. And the DPC guys have 700 to 800 patients in their panel as opposed to 3,000 to 4,000. So like they actually have time to, have a relationship with their patients. If you end up going this route, and either through your primary care or them, and you go out to see a specialist, there's a $75 copay for that. So maybe Hitchcock says, hey, I think you need to go see a gastroenterologist or something like that. You would pay $75 for that copay for anything that happens in the visit. If you are on Employee Plus Children or family through Gold Bond, and you're like, hey, I really don't want to move my kids off their pediatrician, we totally get that. So for kids under 19, there's a $25 copay. If you want to keep your pediatrician, you can. You're just going to have to pay the cost of the visit, because otherwise Gold Bond is paying your membership fee, and that would be unfair. So, but again, that's not much different than what you would have on the HSA plan. In fact, there's no difference. You would pay the cost of the visit either way if you want to keep your primary care doctor. I would say even if you want to keep them, there's no harm in establishing with Hitchcock and going to see them and seeing what it's like, just to give yourself an option. Nobody's obviously forcing you to do that, but I would encourage you, since there's no cost, to at least check it out, see if you like it. If you go on option 2. So again, difference between option 1 and 2 obviously is the benefit for direct primary care with Hitchcock, but option 1, again, everything's going to go towards that deductible on that plan. So, but on option 2, the big difference on your RX card is you will have a full prescription drug list to choose from, and it's a 5-tier benefit on your prescriptions on option 2. So if you take a preventive or maintenance med, it might be on option 1 and 2, but the majority of prescriptions are going to fall under option 2. Doesn't mean you can't fill a prescription on 1. You're just going to probably pay more than whatever the copay is, right? If it's not on that PDL or prescription drug list. But the only tier, there's 5 tiers. So the majority of meds are going to fall that you guys have are going to fall in tier 1, 2, 3, and those are monthly prices. If you take a tier 4 or tier 5 med, there's a chance that SmithRx might reach out to you to see if you qualify for some cost savings programs. It's not a spam call. We're not trying to sell you anything. So please answer it. And because they may be telling you like, hey, you have a grace period, but you need to get a prior authorization or some information like that, right? If you have trouble at the counter, with a refill, or you're questioning the price, you can always reach out and call SmithRx. They have good customer service, and just say, hey, I thought this tiered price was supposed to be this. And they may say, oh, well, there was actually a coupon applied, and that's why it was cheaper. So they can answer those questions. Our team can too, but I would not be afraid to call their customer service. So that was a lot. Again, difference between plan 1 and 2, but the payroll deductions are the same. So you pay the same on either plan. Any questions about the plans though before we move on? There's no bad questions.
And quick note on the medical plan, and just for the medical plans, you'll see that this is the weekly amount down here. So you'll just want to double that to get the bi-weekly deduction. That makes sense. Yeah. Okay.
Any questions from anybody? Again, no, there's no bad questions or wrong questions. If you guys think of them, just stop me. We can come back. All right, so on the next page, on page 11, there's just some brief information about Hitchcock. I'm not going to read through that. They're going to be here tomorrow. You can see some of the bullet points of stuff that they do. Even down to casting, treatment of non-surgical broken bones. So they can do a lot of stuff that you might otherwise have to go to the ER for. So again, I think that you'll really enjoy it if you start to use this plan. The next page is health equity. If you are staying on option 1, your HSA vendor or bank is not changing. So health equity, this is the one I use personally. They're great. Just as a reminder, HSA is tax deferred. So if you put $1,000 in, that 1,000 would come off of your gross income. You'd be taxed on the remainder. You can put up to $4,300 for individual and $8,550 for family. And then if you're 55 or older, you've got an extra 1,000 that you can do. A lot of qualified medical expenses fall under HSA. So if you dental, vision, even some medical devices. So if you've forgotten to, swipe your HSA card, you can also reimburse yourself by going online to your account, putting in your bank account or your checking account. And I've done it a ton of times. So a lot of flexibility with the HSA. And again, if you're going to stay on option 1, I would highly encourage you to at least do a little bit in here, because it's not a use it or lose it. You can keep this for the rest of your life. It's your bank account. But the way to take advantage of the tax piece is you've got to use it on medical, dental, and vision. So that's HSA. The next page is just TextCare. A lot of you probably have used that this year. If you haven't, or if you're new, you will still have this even with the plan 2 or plan 1, whichever plan you choose to go on for medical insurance. But TextCare is it's kind of a pared down version of what Hitchcock is, but you've got a doctor assigned to Gold Bond that is kind of a general practitioner that you can call in for like anything you would do inside a Minute Clinic, let's say, but it's all text message based. There's no app. You don't have to worry about downloading stuff or putting your information in. You just text back and they'll, do a FaceTime with you, or you can just text them or have a phone call. So if if you're out of town, for traveling, you get a stomach bug, you could use TextCare. They could get a prescription for Zofran or whatever, called into the pharmacy, you go pick it up. And there's no cost to this. So you just pay the cost of the prescription, or you might not need anything. You might talk to them and discover, hey, I just need to take some ibuprofen or Tylenol or whatever for my child that's got this ailment. But you can use it for your family, even if they're not enrolled in text or in the medical plan for Gold Bond. So if you're employee only, and you've got kids, you could use it for your kids, which I think is a super benefit, because nobody likes to take their kids to the doctor if you don't have to, right? So that's text care. I would definitely save this number or scan it and save the contact information, because then when you read it, you don't have to figure out where your benefit guide is. Smith RX, the next couple pages. If you're new to the insurance plans, Smith RX is your pharmacy benefit manager. All that means is they're the ones that behind the scenes determine your prescription drug lists and coordinate the filling of the prescriptions, etc. They've got a lot of cost savings programs. Most of them apply at the counter. So like if I go on a medication that has a copay coupon card, it just automatically applies at the counter. And then once that's exhausted, you would pay the tiered price or what have you. But if you're on a high-end specialty medication, again, Smith RX is probably going to reach out to you to either ask you if you have attempted to try the generic version, if it's a lot less expensive for you, or they might say, hey, we've got actually a program that you might be able to get this drug for free. And that is the case for some medications. Some of that depends on your income, but if you don't qualify for it, it's not like they're going to tell you have to stop taking the medication. Still take it, and you move on throughout the year. So, but again, if they call you, definitely answer the phone. It's not a spam call. So that is Smith RX. Any questions on medical related stuff before we move on to dental and vision? No bad questions. We can always come back if we need to. Dental and vision are the same cost, same network, same benefit plan. So Blue Cross is your network. For those that are new or maybe just need a refresher, the way your dental insurance works is you've got 2 cleanings per year that are covered in network. Again, probably hard to go out of network with Blue Cross. And then once a year x-rays, that's coverage A. Coverage B and C would be like getting a cavity filled, or coverage C would maybe be like a root canal or some type of implant. If you have to get coverage or category B or C, you would pay $50 and then either 20% or 50% on the cost of the dental care or dental work. If you got kids under 19, you can use the orthodontics benefit, which is great because it's $2,000 per calendar year. Actually, that's a lifetime. So the way that orthodontic benefits work is, unfortunately, you can only use that per child one time, that $2,000. I wish it was every year because that would be awesome. But on their orthodontics work. And then for your other category, A, B, and C, it's $1,500 per year is your max. Vision, which is page 17. Blue Cross is a network on this as well. You've got a $10 eye exam and then a $40 contact lens exam copay, respectively. And then you've got an allowance that's $135 per year, and you can either use it on frames or contacts. You can't do both in 1 year. And then you've got a lens or materials copay. So you can see that these payroll deductions are biweekly for both dental and vision already on this. So moving on to life insurance. So you do have $15,000 of basic life provided by their company. Because we moved to Guardian, if you flip over to voluntary life, you can, this year, there is a true open enrollment on voluntary life. So if you passed on this before, but thought, hey, I wish I would have bought $50,000 of life insurance or just some minimal amount, you could do that with no paperwork. You can get up to $150. So if you've got pre-existing conditions, I highly encourage you to buy at least some, because you'll probably want it at some point in your life, even if you don't have dependents now. If you have dependents and you don't have a term life insurance policy, I would tell you just get some amount. I'm happy to make a recommendation on how much. Again, you can max it at the guaranteed issue out at $150. You can get up to $500,000, but past $150, you've got to fill out some paperwork. So, and it takes a couple of weeks, and they'll either approve it or deny it. If you're healthy, you shouldn't have any issues. But if you've got a bunch of pre-existings, they'll probably put you back down to the $150. You can buy $20,000 on your spouse and $10,000 on your kids or child. And then again, it's a term insurance policy. So it when you age up, from 39 to 40, let's say, your price might increase, and then again at like 45 years old. But it's a really inexpensive way to buy life insurance with no exam requirement. So if you need some, this is a good way to take advantage of it. Disability, the company pays for you guys to have short-term and long-term, which is a great benefit. So That way, if you have a leave of absence due to surgery or a maternity event, et cetera, you'll be able to take advantage of that. Short term kicks in after 15 days and goes up to 24 weeks. And then long term kicks in after half a year or 181 days. So you can see the benefit amounts. It's weekly measurements for short term and then monthly for your long term. Any questions on those? All right, just stop me. And I can always come back to something prior that we covered too if you have questions. The couple of remaining benefits are, again, voluntary indemnity type plans. So accidents, the first one. I have an accident plan because of having kids that play sports. So if my kid breaks his arm, playing flag football, I can claim, the visit, the physical therapy, the cast. I can claim any part of what happens after that for my claim amount, and Guardian will mail me a check. Sometimes you have to claim each bill separately, which is kind of a nuisance, but at least you're getting, to use your insurance policy, obviously. You can see the bi-weekly deductions. There is a option 1 and 2. I don't think I actually pointed this out previously. Option 2 is just a richer, so it's going to reimburse more per accident. I don't know that there's a right or wrong answer there. Again, if you've got kids in sports, I would recommend it. But or if you're accident prone yourself, I suppose. The next benefit is critical illness. This is different than accident. This would be if you get diagnosed with like a life-altering disease, so heart attack, stroke, Alzheimer's, Parkinson's, cancer, etc. You're going to get whatever lump sum amount you elect for you and your spouse mailed to you as a check. So you can elect either 10 or 20,000. On this, to elect it on your spouse, you got to elect it on yourself. And this does have a wellness benefit. So if you're enrolled in this already, don't forget to just go to Guardian's website and plug in whatever doctor visit you did this year, the date of service, and they'll mail you that $50 check. So hospital indemnity is the last plan. If you are thinking about family planning, having a baby, etc., I would highly recommend that you buy this now because it will reimburse you for your hospital admission when you're in the hospital. I wish that we had done this with some of my kids, but live and you learn. Otherwise, if you're going to buy it outside of maternity, you got to have it before you have like a scheduled surgery or something. Like you can't be currently pregnant, buy it, and then they're going to reimburse you for everything. It's got to be before the claims happen or before a diagnosis happens, right? But otherwise, if you buy it, you'd be good for those events. And if you have it now, again, this one also has a wellness benefit, so don't forget to turn that in so you can get that check mailed to you. Last couple things, just to finish up, employee assistance program. You guys have that free as a part of your healthcare plans. So if you're struggling with like mental health issues, or if you need like legal financial advice, and then they also have an online will prep, which if you don't have a will, again, it's not going to be like going through a local attorney, but you're also not going to have to pay for it. So I would take advantage of that if you got dependents. And at the bottom, you can access it with your Guardian member ID through that website. Last but not least, you guys do have a pet insurance offering through Pet Partners. That's a direct enrollment, so you'd enroll just directly through Pet Partners. They've got plans for puppies all the way up to older dogs, etc. Pets are expensive, so if you have one and you need some insurance on your pet, this is a good way to get it. There is a section in here on your parental leave policy as well as your 401k. We don't manage your 401k, but just aside, Gold Bond does match. I would tell you, my general advice would be not to overload yourself on insurance products and put more of your money in your 401k. But just buy the appropriate amount of insurance that you need would be my advice to you. Anybody have any questions about the benefit guide or anything that I went over? I know it's a lot. I don't expect you guys to remember much of it, but hopefully a couple key takeaways will be good. So.
All right, real quick before you go, you're going to log into UKG as usual for your, and I'm going to show you the screen. That's how it'll look like. You'll see right here, it'll say start open enrollment. Over here,
It'll load.
Okay, don't say that. This is the chat feature over here on the benefits help. Okay, there you go. So you can just type in your question here. There's some conversation starters, but hopefully your question would get answered there. If not, then Emily and I are available as well as the renewal team. Emily has some HR office hours in here. What days?
Friday, Monday, and Wednesday.
Okay. As well, you guys can always pop in our office. If you have employees that come to you with questions that you don't clearly know the answer to, again, just refer them to us. Any questions? Anybody that does their enrollment before Friday goes in a drawing for a gift card? Josh.
Nah, he won't win.
I won't win.
So, yeah. No, we haven't.
I don't win.
I have until next Wednesday. So, but I hope you guys are excited about the features. Super excited about that option too. We really feel like that gives you significant savings. So, yeah. Good deal. Take all that information home to your wife.
No, I'll never call you.
Okay.
Never call you.